Merhaba, bugün size Sialendoskopi ile ilgili bilgi vermeye devam edeceğim. Konuğum var, dünyaca ünlü Sialendoskopi konusunda bir otör. İsviçre Cenevre'den geliyor. Kendisini burada ağırladık ve dün çok güzel bir panel sundu kendisiyle birlikte. Şimdi de İngilizce olarak devam edeceğiz süreci. Sizden gelen zaten sorular oluyor dönem dönem. Bunlara ben cevap vermeye çalışıyorum. Ama kendisine de bu konuyla ilgili bazı sorular sormak istiyorum. Hi, Dr. Marchal, how are you? Welcome to Turkey again. You are my mentor about the Sialendoscopy, and you have a big center in Geneva-Switzerland. I want to ask some questions about the patients and the Sialendoscopy. First of all, what's the complaints of the patients for salivary gland problems and also salivary gland stones? Can you give information?
Yes, sure. The symptoms of the patients are mainly the swelling during meals. They have salivary gland swelling during meals, and because of a blockage of the salivary ducts because of stones or strictures. And the technique that we have been developing aims to remove these stones, and you do that beautifully. You showed us yesterday beautiful videos of that, and this is a way to avoid the glandular resection, which is covered with quite a significant morbidity.
What are the differences and what are the morbidities of the salivary gland resection?
The problem is these are heavy and long surgeries that have long hospital stays, that have risks of bleeding, risks of infection, risks of facial nerve paralysis or nerve paralysis. And I really think Sialendoscopy has been a major paradigm shift in the last 20 years. I'm very proud of the achievements of my Turkish friends. We have a beautiful group around the world with hundreds and hundreds of physicians doing this technique in every country. And we meet during society meetings from the International Salivary Gland Society, Sialendoscopy Society.
And you are the director of us also.
Well, I'm very proud of the achievements of all the people doing that around the world.
Okay. And the hospital stay, is there a difference?
Of course, we have been proving that there is a hospital stay shorter with Sialendoscopy than with classical surgery. So it's less expensive and better for the patients.
Yeah.
And according to the very big names of our specialty, it has been really a paradigm shift in the last 20 years.
Yes. And is there a complication of the surgery, Sialendoscopy?
I think if it is performed in good hands and experienced hands, it is an extremely low complication technique. It's a minimal invasive technique, so the complication rate is almost, it's very, very small.
Yes. Is the how is the price? Because they are very expensive instruments when we use this.
The instruments are expensive. They are also fragile.
Yes.
And I think that this is one of the issues, to maintain as long as possible the instruments to be able to operate a lot of patients.
Yes.
Everything has a cost, but I think minimal invasive surgery is definitely the future of any surgery.
And what do you say after the surgery to the patients? For example, massage to the operation site.
I think it depends on every case. If it's a stricture, if it's a stone, but basically, if it's a stricture that had been dilated, you need to have anti-inflammatory or cortisone treatment, and to reduce the inflammation, and maybe you put a stent. So I think it depends from case to case, but certainly patients have to hydrate themselves. This is very important.
Of course. Yeah, thanks. And also, we held also you held a congress, second Sialendoscopy congress in Dubai in 2020, and it's a very big conference there, and the Sialendoscopists towards all over the world come there, and a very good congress was there. And in 2023, I think you will make a third
Yes.
congress of the
We will have-
Sialendoscopy. Yes, can you give information
yes,
about that?
we had the first congress in Geneva. We had the second congress in Dubai with 130 participants from I think 44 countries.
Yes.
And we invite all the Sialendoscopists of the world to join the third congress that will be in Geneva during the week from the 4th to the 10th, I believe, in September 2023. We will have very good sessions. We will have all the colleagues from all countries, and I count on you to be
thank you.
one of the leaders of this event, and we will certainly have the possibility to have good exchange. And this is important for our patients.
Yes, also in Turkey there are a lot of patients complaints about this, but we couldn't do this surgery towards all of them because our colleagues don't know about Sialendoscopy. So we should do lectures or congresses for them also, and the general practitioners and nuclear medicine doctors too.
Yes.
Okay. I want to thank you for this speech.
Thank you
and
very much.
welcome again to Turkey.
Thank you very much. It's
And
always a
hope
pleasure to be here.
Hope to see you in Dubai. We have a panel in January and also in September
In Geneva.
in Geneva. Okay. Thank you.
Thank you very much.